Hi, this is Dr. Paul Goldberg at the Goldberg Clinic. We have today with us two of our patients returning after, ladies, what's it been, 8 or 9 weeks?
9 weeks.
9 weeks from Sault Ste. Marie, which has a Michigan side and a Canadian side. And our two friends and patients here are from the Canadian side of Sault Ste. Marie. And they came down to see us about 9 weeks ago with multiple complaints, and we're here to see how they've progressed over the past 9 weeks. Paula and Karen. And Paula, we'll talk to you a little bit first. You came down here about 9 weeks ago, and we're reevaluating you today.
Yes.
And if you would just tell the audience out there what you came to us with originally and what has changed over the past 9 weeks that we just started that you want to program now.
All right, when I came originally to see Dr. Goldberg, I was dealing with digestive issues, with menopausal symptoms, with overweight, with low energy, and lots of joint pain. I was quite a mess. And in the 2 months since, I believe I would say that I've had a 40% improvement in all of those. My menopausal symptoms have quieted down quite a bit. My digestion is much better. My energy is much better. I've lost close to 25 pounds. And I feel like I'm getting my life back again. And
we know it takes time because we're not here to just suppress symptoms. It is our orientation to tear people's bodies down a bit and to rebuild them and actually give them new bodies as opposed to just the suppression of symptoms. So 9 weeks, we're still fairly early in the stage of reconstruction. So we're very glad that Paula has already had a 40% improvement in her energy, improvement in her menstruation symptoms, menopausal symptoms, and you've also lost weight. So you say overall you've had about a 40% improvement just over the past 9 weeks.
That's right.
All right, and we're aiming for an improvement from there, but we think that that's very, very good to have that kind of improvement just in 9 weeks. And Karen has also came down. The two ladies are friends, or actually cousins. Your cousins.
First cousins.
First cousins. Both from Sault Ste. Marie, only live about, what, about 5 or 6 miles from each other?
Oh no, about 5 or 6 minutes from each other.
5 or 6 minutes from each other, okay. And Karen, could you give us a little encapsulation of your experience, what you came down for, and what has been going on with you since that time?
Yes, so I came down here with autoimmune issues, joints, and pain, swelling, and that was my biggest concern. And my next biggest concern was digestion, and then there was fatigue, lethargy, and I was losing my passion for life. I wanted to do things, but it was just like I couldn't get going to do it. It would be in my mind to do certain things, but then I just sort of lose a passion to do them. And so I can honestly say in the 9 weeks that I followed this boot camp process that I have gained that passion back. And I feel so excited about just traveling and going places and enjoying my life with my husband and laughing with my cousin, and it seems like my sense of humor is bubbling again, which I just really appreciate. The next thing is stamina, energy. I'm amazed that within 9 weeks I have had at least a 40% increase in that. Even just standing at my kitchen sink, I'm saying, oh wow, I can stand here with a whole lot of pain. Now mind you, I have to say there's only been about 10 to 15% increase in my joints, but as Dr. Goldberg...
Improvement in your joints.
Improvement in my joints.
Yes.
What did I say?
Increase.
Improvement in my joints. But as he explains, you know, we have to redo the body, redo tissue, and perhaps in 10 years from now I'll have a whole new body, but I'm looking forward 6 months down the road or a year down the road to feel even a lot better than I do right now.
And we really like to see the improvement that you've had, Karen, as I was explaining to you, in your energy and in your stamina, because until we get those mitochondria of your cells really functioning and putting out some ATP, putting out energy, we can't expect to see other areas improve. So now that that stamina is improved, that energy is improved, you're already seeing about a 15% improvement in your joints. I think that bodes very well for the future of you. Yeah.
Wow, thank you.
And can we get your, would you ladies be willing to divulge your ages to our audience here?
Certainly, I'm 58.
58.
And I'm 68.
58 and 68. So these ladies are still only in middle age, but we like to think that we can help people almost at any age recover their health as long as they work hard like both of these ladies did. We didn't do it at the clinic, all we did was offer guidance so that, again, as we say in these videos, we can turn healthcare into self-care. Thank you.
Can I say
Yes,
something?
please.
When he said guidance, it's amazing guidance. Like, it's amazing grace. That's how I feel. And that to have doctors respond to you within hours of your email is just amazing. I've never experienced anything like that in my whole life.
Really, truly, the guidance is, the support is wonderful.
Yeah.
To be able to speak to them each week about any concern we have and is awesome.
Yes, well, by the way, we give most of the credit there to Dr. Tenner, who I stand over with the whip, and who does do a very, very excellent job. So,
I have
kudos to Dr. Tenner.
Yes.
Yes, I just feel like, you know, I just have a very special relationship with Dr. Tenner, an email relationship.
Well, believe me, it has been a real blessing to our clinic to have Dr. Tenner here so that I don't have to be involved quite as much with the emails as I once was. And he does, as you said, thank you for pointing that out, he does a really excellent job of that.
He does.